And we are back. Today is National HIV, AIDS, and Aging Awareness Day, which is a time to reflect on many ways adults with HIV and AIDS are living longer, healthier, and they're having better lives because of medical advancements. Now, the needs of older adults living with HIV or AIDS can be more complicated, and many advocates say the stigma and prejudices around it continue to be a problem. Here now is the LGBTQ plus program coordinator, I almost messed that up, all the words up there, program manager, I should say, at VNS Health, Arthur Fitting. I was doing good.
Yeah.
And then all of a sudden I started putting letters together and then program. I was like, Arthur's here. He's going to talk to us.
Yeah, I'm really glad to be here, Darren. It's nice to be back, and it's always great to come to the Bronx. I really love it, and talking to the Bronx people. And it's just really great to have you talking about this subject. It's so important for people who are aging with HIV.
Right.
And we find that there's been a great, advances made. In the beginning, when I started my nursing career, it was in the beginning of the AIDS crisis, and we really didn't know what we were, doing then, because we were working in the dark, and there was so much unknown at that time about AIDS and HIV. And then luckily with VNS Health, we were able to develop different care models to kind of adapt to the situations, to be able to keep people at home longer and in the privacy and really the dignity to get the care that they needed. And of course, there was no medicine at that time. And then we see now the advances that have been made, and a lot of the advances have been made by many dedicated, professionals who've been in the field for a long time, doctors and nurses, therapists, researchers, and community advocates. And many new pharmaceuticals are online now, and it's really extended the lifespan, can extend the lifespan for many people who are living with HIV.
You talk about that, and there's some great progresses that have been made, but I also want to talk about some of the challenges, because one of the challenges is testing, right? And talk to me a little bit about this testing, because the lack of HIV testing for older adults is quite prevalent.
Right. There are many reasons for that. One is still big areas of stigma. Mm-hmm. People who are older are reluctant to get testing because of just the stigma that's attached to it. Also, in many healthcare settings, the standards for your normal physical is HIV testing is not done after the people are in their 60s. There's a real lack of understanding that people are having sex, after their 60s, into their 60s, and need that testing done. So it's not even being offered to some people. Also, the testing sites in some locations in the Bronx, like there are less testing sites, that people have to really look for them. Also with testing, that many of the healthcare providers who are not specialized in HIV are still reluctant to ask about sexual histories. And so that's a very unfamiliar area that patients have in bringing up with their doctors. So that whole area sometimes is not even spoken about.
Speaking about area, talk to me about the Bronx. I know there's some accessibility challenges that we have here in the borough, and particularly here in the Bronx. Talk to us about that.
Well, the Bronx, is one of the largest areas where HIV is now, and that sometimes people don't know where the testing centers are. There's also, a lot of the health education for HIV has been directed towards a younger audience and not towards the older audience. So a lot of the people who are living with HIV for a longer period of time, or people who are older, don't really know where to go for testing. So one thing that people can do is call 311, and that they will give you the name of a testing site near them, near where they live. Also, one of the sexual health clinics that New York City Department of Health has.
Mm-hmm. So Arthur, for yourself, as you look through the years, you can see there's been some positive gains, particularly in the area of awareness and education. But how big still today is stigma? Because you talked about when AIDS first started, and HIV, and there was huge stigma and huge misunderstandings and stereotypes. But now we look today, how prevalent are we looking at, stigma and stereotype? Because sometimes it's hard for you to just get that word across if somebody's already got this instantaneous barrier there.
Right, and it's also generational. There's a lot of
Right.
generational issues that come up, and that with the older population, there's a great deal of social isolation. And part of that's related to the stigma that's attached of HIV. So it's really important that people try to integrate people who do have HIV into the community. One thing at VNS Health that we do is just really provide care in a safe space, so there is no stigma attached. So that people who have HIV, we've been taking care of people since the beginning of the pandemic till now, and we have a great clinical staff that's very well, knowledgeable with all the things that are going on in HIV. And we also have health plans that are specifically looking at how best to take care of people with HIV.
Yeah. So for people who need more information in terms of tapping in, and if they're watching at home right now, saying, "Listen, I want to tap in on the conversation," some resources that are available. What are they doing?
Well, a good thing would be to go to our website, also. And one of the other things that people can do is look at, community-based organizations in their area. So, organizations like SAGE or GMHC really offer a lot of information to people free that they can get.
Mm-hmm.
We also have a lot of information that we can give to people. A lot of times people don't really know what they want or what they're looking for. And a lot of times with the older population, they really need a safe place to call.
Right.
And so they can definitely call us.
So walk me through your job as a program manager. What does this entail?
It entails a lot. It's, with the LGBT population, LGBT health is a relatively new field.
Mm-hmm.
But one of the good things that has really happened is that VNS Health has been a real pioneer in this area. And the VNS leadership people have really supported this community for a long, long time. And so it deals with a lot of community outreach, going into the community, doing healthcare education. We go into the community and we do, health assessments. We also promote, our different programs that we have. I work within the agency. We have many different programs at VNS Health. We have behavioral health. We have our health plans. We have hospice. Those areas that really people are not aware of how that affects the LGBT population, like with hospice and how does that relate, and how are people using those services.
Yeah, a big educational tool, I guess, for a lot of people out there who may not be so familiar. The resources are out there to really connect. As we go forward, what would be your advice for people who are, on the fence about saying, "Listen, maybe I don't want to really delve in and get the information," but information is critical, to have and to do, so that way you can have a more successful life. What do you say to people who say, "Listen, who may be reluctant because of stigma"?
Yeah, I think that's really a big barrier. A big barrier for accessing care is the stigma. Mm-hmm. And what I would say is that there are safe spaces where people can go for care. And VNS Health is a safe space. There are community-based organizations that are safe spaces. And I would really encourage them to access that. If they come onto our website, we have many areas that they can look into, and they definitely can call me as a resource person.
Glad to have you. Oh, it's been good to see you again.
Thanks so much. It's glad to be back in the Bronx.
Oh, glad to have you again. All righty. Well, listen, now, if you do want more information, go ahead and visit the website at vnshealth.org. Call them at 800-675-0391. Ask for Arthur. Don't go anywhere. We'll be back with more Open coming up right after this.